The COVID-19 pandemic has caused many Americans to delay healthcare treatment, from standard routine exams to important elective surgeries to even ER visits. Dr. Jijo James is here to discuss a new effort to help people prioritize their health and get information that they need when they're pursuing their health care so they can do so with confidence. Hi, Dr. James.
Good morning. Thank you so much for having me here.
Happy to have you here. So what did this survey show about patients deferring healthcare treatments during this pandemic?
So, we've discovered that COVID-19 has not only harmed those who've contracted the virus, it's actually impacted the health of people who've deferred needed medical checkups, tests, surgeries, procedures. So, to understand this better, the Johnson & Johnson medical devices companies worked with the Harris poll to survey about 2,000 Americans across the US in the middle of July. And we discovered that more than two-thirds of Americans say they or someone in their household had deferred essential care during the pandemic. And this, as I said, included things like important elective surgeries, ER visits, standard routine exams, things that experts believe could negatively impact their health in the long term. And which is why Johnson & Johnson Medical Devices launched myhealthcan'twait.com, which is an educational hub to encourage patients to re-engage with healthcare and have a meaningful conversation with their physician.
And what kinds of tools are available through the My Health Can't Wait online toolkit?
Sure. So it includes simple things like a caregiver or patient checklist or discussion guide, but very important in helping having that meaningful communication or conversation with their physician. It includes safety FAQs, which are a list of measures that hospitals or surgery care centers may be taking to ensure the safety of patients during the pandemic. We also discovered that about 73% of patients were willing to use their phone or computer to engage with their healthcare provider. So we've included telehealth one-on-one resources to help them figure out how to engage. And perhaps most importantly, it includes patient stories so that patients don't feel isolated and feel that they're part of this larger community and could potentially learn from each other.
And how can patients and caregivers give this resource for ongoing treatments?
So by logging on to myhealthcan'twait.com, they can have that more meaningful conversation with their physician. So, for example, anecdotally, I'm a physician and I'm fortunate enough to have my 82-year-old father live with me. But when he needed dental care, I froze. I didn't know what to do. If I had access to a resource like this, it would have encouraged me to proactively reach out to the dentist. Now, fortunately, the dentist gave me a call, and just that one phone call and that conversation with him allowed me to re-engage with the healthcare system with confidence.
All right, Dr. Jijo James, thank you so much for being with us. Really appreciate it. And we'll be right back with more Midday Maryland right after this. Stay tuned.